You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Today we listen in as Stacy Lavilla, Director of Communications at AAPCHO, interviews Dr. Sam So, Head of Asian Liver Center at Stanford University.
Dr. Sam So is the head of the Asian Liver Center at Stanford, which is the first nonprofit organization in the United States to address the high incidence of hepatitis B and liver cancer in Asians and Asian Americans. My first question, Dr. So, is three-pronged, and that is, what is to be done in the area of programs, policy, and advocacy if we're to reduce the incidence of hepatitis B and liver cancer? So can we start with programs, please?
Hi, Stacy. So I think one of the most important aspects is first, our policymakers have to recognize chronic hepatitis B as a major health disparity. And once that's been achieved, then we need to implement what are some of the programs I feel are essential to address this. Firstly, to make sure that all healthcare providers are aware of the most recent recommendations calling for every foreign-born person coming from endemic countries and those who are born to foreign-born parents have a one-time blood test for hepatitis B, and to incorporate that into the standard of care. Secondly, they need to learn about how to provide long-term care for those with chronic hepatitis B, and what they should advise their patients to do to prevent transmission of the infection, as well as protecting their loved ones from chronic hepatitis B infection.
Can you say what needs to be done at the advocacy level?
I think from the advocacy aspect, we need to make sure that there are legislation which will provide resources for programs, which some of them I listed earlier. And make sure there are resources for screening, for surveillance, for treatment, and also access to affordable treatment for those who are uninsured or inadequately insured. We do have a hepatitis B bill on the Hill, and without adequate advocacy from all the constituents, it's not really going to go anywhere. So we really have to organize a concerted effort to get that bill passed. So the resources will flow down to the state level and the community level to address this major problem.
And my other question to you is, how important is it to raise awareness?
Raising awareness is crucial because there's overall a lack of awareness about the prevalence of chronic hepatitis B, the consequences of non-intervention, the risks of liver cancer and liver disease. And this has been confirmed by a lot of survey studies, which found that regardless of the different ethnic groups, particularly in the Asian American community, knowledge level about hepatitis B is extremely low. And recent studies of the knowledge level of healthcare providers, the doctors and nurses, also reflect this lack of knowledge and awareness. So if we are really serious about trying to eliminate or eradicate the threat of this disease, we need to start with education and raising awareness. Just like the way we teach people about the risk of breast cancer, the need for breast cancer screening starting from a certain age.
Do you feel that we've made some strides in this area, and where?
The efforts in raising awareness has made some major stride in certain communities, like the community in San Francisco. We have built a really great partnership between the public and private sector to raise this as a major community health problem. But overall, this has not been the case nationwide, and a lot of work still needs to be done. And without federal resources to fund a nationwide campaign, it would be hard going.
And can you list your 3 priority areas moving forward with respect to hepatitis B and Asians and Pacific Islanders?
Firstly is awareness and education. Secondly is making sure a routine screening of Asians for hepatitis B become standard of care. And thirdly, providing access for long-term care or treatment for those who are chronically infected.
Thank you, Dr. So.
You're welcome.
This podcast was brought to you by AAPCHO with generous support and guidance from its Technical Innovation Advisory Committee. Please send your comments and questions to podcasts@apcho.org and tune in for our next podcast at www.apcho.org.